Do you feel pain when moving your fingers? You are watching the fourth part of the first episode of diabetic hand diseases. There are 5 types of hand diseases caused by diabetes. We have mentioned chiroarthropathy, Dupuytren's contracture, and carpal tunnel syndrome in the first 3 parts. In this section, we will only mention Flexor Tenosynovitis, which is also called trigger finger. In this video, we will find out: what is trigger finger? And what are the causes of trigger finger? And what are the symptoms of trigger finger? And what can be the effects of trigger finger? And how is trigger finger diagnosed? And finally, see how trigger finger treatment is possible. Generally, trigger finger is the condition in which the fingers hurt due to inflammation in the tendon. Your fingers have pulleys that become tight due to inflammation, and a tendon runs through the middle of the pulley, which cannot move due to the inflammation of the pulley. Due to continuous movement during inflammation in the pulley, inflammation also occurs in the tendon. Due to inflammation in the tendon, the finger joints become sensitive and hence pain is felt during movement. There are bones and tendons in the hands and fingers. Tendons that move and connect muscles and bones together. The muscles in the fingers provide flexibility in the fingers, which help to straighten the fingers and also help to turn the fingers towards the palm, while the tendon moves within the pulleys if the pulleys are inflamed. Pain is felt during which is called trigger finger. When the tendon passes through the pulleys, first A1 pulley comes, then A2 pulley, then A3 pulley, then A4 pulley, and so on, finally A5 pulley. If one of these pulleys gets inflamed due to any defect or injury or suffers from inflammation or due to any other reason, pain is felt in the fingers while moving. It is very important to know about its symptoms. When the fist is closed and opened, a shock is felt in the fingers. Apart from this, there is a feeling of stiffness and pain between the joints of the fingers. When there is stiffness in the fingers, due to stiffness, or during the stiffness, the fingers are straightened, then during this period, the sound like breaking a bone is also prominent. Now we will see in which people this disease can occur. This is mostly in diabetes patients, who are between 40 to 60 years of age, hypothyroidism, arthritis, TB patients, or people who use their hands more in their daily work. If we talk about the diagnosis of this disease, a specific physical examination is done for it, while if we talk about a laboratory test, no specific laboratory test is done for it. Yes, if you are suffering from diabetes, then some tests can be done to help diagnose it. On the contrary, if we talk about radiology, it may be needed in patients who have a lot of swelling of the hands, or whose movement between the joints of the fingers is impossible, or those who have wounds in the joints of the fingers. Now we will talk about its most important part, that is, about its treatment. You can treat it at home. If the nature of your illness is minor, then you just have to leave your daily activities and rest for 4 to 6 weeks. A splint can be used to prevent movement. You can also apply heat to reduce inflammation. Or you can improve its movement by creating flexibility in the fingers. You can also treat it with medicines which are more effective. Pain relievers such as ibuprofen or naproxen can also be used if the pain is severe. Apart from this, the use of anti-inflammatory drugs and due to excessive inflammation, steroid injections can also be injected. We will be releasing our next video soon where you can learn why diabetes makes you weak. If you like the video, don't forget to subscribe to the channel and like the video.